Welcome everyone to today's webinar. I'm Mackenzie Dean with Becker's Hospital Review. We will begin today's webinar with a presentation, and we'll have time at the end of the hour for a question and answer session. You can submit any questions you have throughout the webinar by typing them into the Q&A box you see on your screen. We're looking forward to hearing your questions. We'll also have a series of audience polling questions during today's webinar. The poll questions will pop up automatically on your screen throughout the presentation. When the poll question launches, please select an answer from the options on your screen and click Submit. And thank you in advance for your feedback and perspective. This session is being recorded and will be available after the event. You can use the same link you used to log into today's webinar to access the recording. At this time, it is now my pleasure to introduce today's presenters. Jamie Shields is the System Vice President of Consumer and Digital Experience at Advocate Aurora Health. Marie Friedman is the Director of CRM at Advocate Aurora Health. And Gary Druckenmiller is the Senior Vice President of Strategy and Innovation at Healthgrade. At this time, I am pleased to turn the floor over to Gary to begin today's presentation.
Great. Thank you very much for that introduction. Very, very excited here to be here with my two friends from Advocate Aurora on what we are continuing to and about to embark upon another great journey in healthcare transformation that is spanning multiple solutions over multiple departments over a significant period of time. And as continues to be, Advocate Aurora continues to be at the forefront of this level of transformation within our space. So I would like to personally welcome Jamie and Murray to this great session for today. Today's goal is to explore how Advocate Aurora Health is building what we have classically come to know as a seamless consumer experience that hits across multiple consumer touchpoints. This is a big exercise. It takes a lot of people, it takes a lot of tech, it takes a lot of smarts, and this ability to simplify to meet the consumer's needs. And no time more than the present does this need become at the forefront. And many might even say that our Netflix blockbuster moment has officially arrived. And what does that mean? I mean, we kind of know at the end of the day what the outcome of that was, right? So we know when we make a seemingly somewhat joking but serious statement about that, we know where Blockbuster ended up. They ended up at the end of a cycle where they did not keep up with consumer and customer demands. They did not keep up with the changing marketplace. They did not keep up with technology. I could go on and on and on. And they're left with one store, some tucked away in some quiet, distant corner of Oregon. We are at that moment in many respects within the healthcare space. Which direction are we going to go? And when we talk about the Netflix blockbuster moment, there are a plethora of new entrants. In many respects, those who have been dabbling their toes and dipping the toes in the waters of healthcare now for the past several years. If COVID did anything, they awoke these giants. And these giants have been watching the healthcare and provider space and hospitals and health systems across the board for years now, and seemingly took a very close eye at what was happening during the pandemic and continues to happen. And they have now, almost at the strike of the same clock hand, decided to go full in to healthcare. And at the end of the day, that general presence, that push, is putting a lot of us inherently in the provider space at risk. When we talk about the Walgreens and the Walmarts and the CVSs and so on entering into this space, because they're the ones that are going to be looking to disrupt the market, to change the patterns of consumerism as we know them today. When we look at what some of the other aspects of this market are doing, and we're trying to understand how others are thinking, here's a great quote from the president of Clinical Pharmacy Solutions at Humana, saying people live their lives more horizontally. And that includes interacting with the healthcare system in a myriad of commerce ways. You have to think like a retailer. This is the arena at the end of the day that we're speaking to when we talk about these disruptors coming in and shaking up the market, shaking up consumerism, and shaking up the dynamics of what we're looking to do. So everybody is putting their arms around and trying to codify this general notion of what disruption actually means and trying to embrace how other markets and other industries have done this in the past, and trying to, at the same time, simplify those discussions in a manner that not only keeps up with consumerism, but dramatically starts to get ahead of it. So how are some of the factors coming into play for a consumer-first mindset? And this is, in fact, what Advocate Aurora is now embarking on, this consumer-first mindset. And they're quadrupling down on this effect, not just for the sake of Advocate Aurora, but to almost disrupt back against the disruption and flatten the line of that horizontal view for the consumer and ultimately, the large output of their patients and customers that are going to be rolling through their doors. Well, they have to start thinking more broadly. We can't think about tech solution to tech solution to tech solution or moment to moment, although all of those are important. We have to think horizontally. We have to think about the entire journey from first point of contact through the lifetime of an individual. Mastering the data and then turning that data into action. We are on, in this particular space right now, how many calls per day where the conversation is centralized around data harmonization, standardization of attributes, and really trying to hone in on a profile of what not only the best customer looks like, but others as well as they're entering in and out of the digital front door. Staying targeted is a very important component when it comes to automation and personalization. That is, in effect, what retailers do best. Retailers establish an experience base that is unlike any other, and they've been doing it for decades. Nobody knows how to personalize or go peer-to-peer or one-to-one better than a lot of the health retailers that are entering into the space. In that same effect, they also know when to pivot away from things that aren't working. So this becomes an exercise of consumer first, of not just what we're doing well, but what isn't working well, and getting rid of those things just as fast as we try to test them and put them into market. All of this allows us to begin to demonstrate what we classically define as indisputable ROI, measurements that we can tie back to a lot of these innovations that are in fact reputable to those moments where we're doing commerce, we're exchanging transactions, and revenue is being consumed in a manner that is reputable for the organization and continues to get us back on track for growth coming out of COVID, because many health systems across the country are struggling getting back into motion again, not just from marketing, but just from other factors as well, clinical, administrative, and so on. So that ROI is once we start demonstrating that again by doing all of these things, that's when we know we've made the turn and are heading in the right direction. So consumer first, as you're all about to see, is all about show me, you know me. This is an exercise with Advocate Aurora where they, again, are quadrupling down on the individual, getting to standardized data sets, standardized solution sets, standardized process control, quality. No stone is being left unturned, so that at the end of the day, they can cut across all 6 of these parameters and will be able to, in a very satisfactory way, say, we are not only doing this, we have either completed it, we are on our way, and in many respects, by finishing all 6 of these, they can say that they truly, truly understand the ins and outs and experiential and behavioral understanding of their customer base. And that is the ultimate goal, to disrupt back against a retail disruption framework that is already doing this today and have been for quite some time. So thank you for letting me have that set up for both Jamie and Murray. I'm now going to hand it over to Jamie to begin to explore the Advocate Aurora story.
Thanks, Gary. As Gary stated, this is all about creating that seamless, connected consumer experience. And for Advocate Aurora, we want to be clear, we're going to show you a couple of big chunks of that journey today. But this is a marathon. This is a journey we've been on for many years. But at the end of the day, it really does all start with the consumer. And as we've looked at it, extensive primary and secondary research, really surveying the market, as Gary stated, the consumer expectation is so high right now, and we have to really embrace and understand that and bring that into healthcare. Consumers have these expectations that they're experiencing in the financial industry. Mobile banking, when was the last time you went into a branch? You can do most of your transactions via your mobile device. Travel, you can book a ticket, check in, and get on a plane with your phone and your watch. So now some people prefer kiosks and others prefer to talk to folks. And when we've looked at what these expectations are and what they mean to us as an organization, we have to be very conscious that those folks are bringing that into healthcare, and healthcare cannot wait anymore. We have to respond. We've also looked at this from a business perspective. So in the next slide, you'll see some data around the value of CX. We all know, and we've seen data from inside healthcare and other industries, that embracing the consumer, being consumer first, is frankly good for business. Not only does it give you the opportunity to surprise and delight your consumer, but it builds loyalty, it drives that retention, that word of mouth, things like share of wallet. So we're really looking at this holistically around the consumer point of view. Again, multitudes of research and design sessions and things to inform that work. We're bringing the business lens, and we're using that to frame our overall argument. As we ask for investments that the company is making in consumer first, we're using both sides of that coin to not only shape that strategy, but to define the investments. And as Gary stated, in some instances, we're looking at efficiency and cost management. Other areas, we're looking at ROI, and then the overall lift that can be provided in the brand. I think in this next slide, you'll also see, at the end of the day, we know why this is important, right? We know that brands, the impact that a brand plays in other industries is equally critical in healthcare. And we need to better embrace that and look for ways to better engage consumers around a great brand experience. And that is in all of the touch points. It has to be seamless. It has to be personalized. When you think about the amount of data that a healthcare organization has about you, doctors see without your clothes on, so at least pretend you know my name and can engage with me directly across all of these channels. It should be, outside of the exam room, equally personalized, equally connected, and equally direct. So we have this data and all of this research that on the next slide has really framed up our consumer-first vision. This idea of being seamless, of being connected, and being personalized. We're a large integrated healthcare organization that spans a couple of states. We're on the other side of a merger and bringing two systems together and combining operating models. And it's time for us to really focus our lens on
I can try to pick up from here a little bit. And I'll actually probably move to the next slide, which might help explain this a little bit more until Jamie can pop back in. So what we've tried to look at here is a broader view over a number of different parts and pieces. It's easy to just look at a visit. What does it take to get me in the door? How do I complete the visit? Thankfully, I did a good job and I walk away, but we're really looking at many different elements here. Self-service, whether that is around digital online scheduling, but a more complete app, and finding different ways to do that. Make it as personalized as we can in terms of not just the encounter, but leading up to that, after it. And the rest goes on, and I think we have Jamie back. Sorry about that. That's okay. Good old work from home, and I got to share bandwidth. I had to kick everybody off of Netflix upstairs. So we're looking like we're on the seamless and connected slide, and I'll reiterate quick, and then we can jump in. Really expanding the view that we have, and I think as Murray was articulating,
we know that that patient experience is at the center of what we do. But at the end of the day, we want to broaden that relationship. Before you need us, how do we provide information to you to live well and healthy and happy? After you've experienced us, how do we help you get back to your version of live well? How do we get you back to doing the things that you want to do? And we know that the core of that is around self-service, personalization, and anytime, anywhere access. And I also just want to reiterate at the bottom of this, safety and quality, we are first and foremost a safe clinical enterprise that is dedicated to delivering the highest quality care. So that permeates our entire consumer experience story as we look to put these pieces together. So this is the foundation for us. It's in consumer research, it's in insights, it's in our business knowledge that has really helped us frame our overall consumer experience journey. So on the next slide, what I want to do, there's kind of two pieces of this that we want to set up for you. The first is this idea of strengthening the core, strengthening today, and really understanding where we want to go and what does that look like. So we're going to talk about our digital platform strategy and our Live Well strategy because they're really about awareness and acquisition and how do we pull people into the conversation with Advocate Aurora. And then Murray's going to talk in much more detail around, as Gary was setting up, how we're building the foundation for the future. So first and foremost, when you look at our digital front door, I know this is a super hot term in healthcare right now, really active in the mobile space. I would still argue for us, it's our websites. We still get over 35 million visits to our big three digital properties. So as part of our strategy, we want to have a unified content management system, not the CMS that's otherwise known in healthcare. But as we look to better deliver an unauthenticated, again, awareness experience, we want to be in a unified content management system that allows us to scale and do things very quickly and very efficiently. We learned this lesson directly during COVID as we were needing to build resources and communicate with consumers. How we used our websites became very critical. We also have a design system in place so that no matter which of these digital touch points that you interact with us on, you will see a fairly consistent experience. So our brand expression, our consumer expression is consistent across our digital properties. This is where our conversion activity lives, online scheduling, our provider profiles. It is still a huge part of our overall consumer experience journey. On the next slide, you'll see our journey in the mobile space. We are an Epic shop. We leverage myChart functionality for that core experience around the clinical transaction, but myChart is transactional. So for us, we started on kind of the myChart app out of the box. We put our logo up in the corner. We use that to establish a foundation in mobile with our consumers. We've been on an iterative journey. The next release of that added some features, looked at a different level of branding. And again, many of you in the healthcare space that use EHRs are leveraging this kind of functionality. But for us, the vision is bigger. Go back to that seamless experience before and after you need us. We want to start to look at not only leveraging the transactional, also how do we move into the health and wellness space and bring in content and tools that help you live well. And that's really gotten us to this 2.5 release, which we're at, which is the newer version of Live Well. So in the next slide, you'll see a few details here. We're introducing not only foundational work from myChart, we're aggregating the family. A lot of research that says not only am I managing myself, I'm managing my household, and I may be managing an extended family with my parents or others. Using this to aggregate that view into a single dashboard, we have introduced health and wellness tools like guided meditations, HRAs, and healthy recipes. We've seen a near 460% increase in engagement in that wellness content over a 3-month span. In the midst of lockdowns and people struggling with COVID and things like that, meditation, health and wellness tips have come in very handy to those individuals. The other side is leveraging the platform for promotions and alerts. We have a symptom checker there. We're in the process of building a platform called SafeCheck, which will allow you to do a pre-COVID screening before you come in to the organization. And then foundationally, this is also a platform for improved virtual visits. We're one of the first systems to integrate Zoom and the Epic kits into the same experience. So you now need one app, LiveWell, to complete a quick care video visit or a video visit with your provider. And I think all of you in this audience have seen things with respect to virtual health that you thought you'd see in 2025, but are seeing today when it comes to volumes and activities. So our websites and LiveWell are becoming this platform, awareness and acquisition, critical parts of the consumer journey. LiveWell is really driving that engagement and that connection. And our goal is to start to build systems that really connect you in a much deeper way. Real quick on the next slide, just a few numbers around LiveWell. We have seen a meteoric rise in downloads this year. We've seen an amazing use of this system from a health and wellness standpoint, so a great increase there. And our HRAs, these tools are quick and easy to use, health risk assessment. We see a much higher conversion rate on our LiveWell app than we do across any other channel. So trying to meet consumers in multiple places, web or mobile, what does that look like? What tools can we present to make that a connected and seamless experience? I think these two items are important because digital is still kind of this foundation. The digital front door, whether it's your sites or mobile, are still those major touch points when it comes to your consumer experience. So let's shift gears to the big foundational work, the backbones that are going to power the future of this and really allow us to reimagine where we go when we talk about engagement moving forward. Again, we looked at our consumers and what that experience was like, and Murray's going to talk about that in just a second. But I want to talk a little bit about the data that we're looking at. We have multiple call centers, multiple messaging systems, multiple avenues that consumers can engage with us outside of digital. And we wanted to really look at what is the opportunity for us to consolidate and deliver a better consumer experience, but also to really help the business as we look at the changing landscape of healthcare. We went out and did some benchmarking with our partners, Healthgrades and Salesforce, our organizations that we're working with. They helped us really understand what the landscape could look like and how this work comes forward. So we use this as kind of a level set as we started to look at the space moving forward. On the next slide, we dug into our consumer data. We wanted to understand what was happening and what some of these opportunities are. I happen to lead a digital team. We're all over digital. But as we've done some research with our consumers, when it comes to appointments, they still want to call us. That's okay. We're going to give you all the channels. But what do we need to do to make that experience exceptional when you call any one of our call centers? We also looked at this opportunity around abandoned calls. Almost 800,000 calls a year were dropping. We had folks in line ready to do business with us, and we couldn't seal that deal. Huge opportunity for us to manage that and close that gap. And then when you look at efficiency and productivity, if we have better technology in place, better platforms that power a better experience, there's a huge opportunity to better engage our staff. They can be more productive, more efficient, have the tools in front of them, and embrace being brand ambassadors for the organization. Embrace this idea of consumer first, because the tools are not slowing them down. They're actually augmenting them as a staff. And from a business perspective, if we can reduce some of those drop calls and make our teams more efficient, huge opportunity to get more business and bring that in the door and build those relationships as they move forward. On the next slide, I'm going to hand it over to Murray, and he's really going to talk to you about the journey we've been on and share the story of Molly, because that's the framework that we've used to engage our leadership around what consumer first means and why we need these singular systems to power that work moving forward. Murray?
Thanks, Jamie. One of the things that we did, and I think you will, it's easy for you to find these examples in your own organization, and it's important that you do find them. Pick whichever one makes sense to you, but this was one of the first ones that popped up a couple years ago. Poor Molly. And this is a very real situation, and it's one that so many women can identify with. She gets at least 6 different messages as reminders about her mammogram. Different departments, different teams. It's a phone call. It's a letter reminder. It's several different emails. Not coordinated, not aligned, even the substance of the messaging a little bit different. Radiology has an opinion, primary care has an opinion, everybody's got an opinion, and they're not wrong. But in the end, for the good of Molly, you have to come together and say, let's get our act together and find a better way. Similarly, because we do cover a couple states, a lot of different markets, we're not yet at a point where we can have, I'll say, a single call to action, meaning just call 1-800 or just click here and schedule your mammogram on the spot. We can do those in a lot of markets, just not consistently across the board. So it's something that we are working towards to fix that. One of the things that we started, and we're still in the middle of, is doing an inventory of all these communication systems. And I wish we hit our limit at 17 million messages that we're pushing to our patients. We've now identified we've well exceeded that. So, and averages are not appropriate because this would suggest that 6, 7, whatever the number of messages per patient are happening. But unfortunately, what's going on is there are a lot of patients don't get anything, and some are getting 10 or 15 messages a year. Again, often a comment internally is, well, better to make sure we over-communicate than miss somebody. I would like to say that's probably right, but as you've all probably experienced, when you're inundated with too much, you consume nothing. You don't read it, you don't open it, you ignore it. And at some point will unsubscribe or just, walk away. And so that is not what you want to have happen. So as we're trying to work through this on the next slide, what we're doing is, and you can hopefully identify with some of this too, the very bottom left, an electronic health record. We use Epic. Ideally, there is one single vendor, one EHR that is providing that service for you. Most folks can agree that's probably a good thing. Well, if it makes sense that way, why doesn't it make sense for, as Jamie is just touching on, the digital platform for your websites? We had a number of different content management systems, not aligned, not connected, problematic. COVID really exposed the challenges with that, so we're moving towards a single platform. Similarly, call centers. We have dozens and dozens of different call centers. Now, that could be a 2-person shop within a department or a service line, or it may be 100 or 200 folks in a organized call center. But we have dozens of these not connected. So if you call into one and then call back, you could end up at a different place. They don't realize what happened, and poor Molly pays the price for that. So we're looking to move to a single call center platform, software, and all the rest that goes with it. Same story on CRM, customer relationship management systems, so that there is a single customer-oriented record of engagement with all the different activities that you have. It's a pile of work, but it's worth every bit of it. But what I want to stress with this, and I'll touch on these a little bit more, but the conversation, it's easy to just focus on software. That is only part of the story. And if you aren't looking at your strategy, your internal systems, your policies and process and workflows and that kind of thing, if all you do is take what I did in one software and just swap it out for another software, you haven't solved the problem. You may have eliminated some systems, but you have not solved the problem, and you've got to stay focused on Molly or whoever you wish to call him or her. But the patient and the customer has to come first, and there are countless examples of that. So I just want to reiterate, look at your strategy, think differently, think very differently about this, and find a way to make it work. These are not easy solutions. It will take a lot of negotiating, but it's worth every bit of it. So on the next one, I'll just focus a little bit on CRM. The key here is unified, and I've broadened our conversation to not just be a literal CRM platform. We have one for our foundation work on philanthropy, one around marketing. The bulk of the other 20 plus systems, I wouldn't call them CRM, but I would call them outbound communications. It could be email, it could be phone calling, it could be text messaging. I think we've identified 4 or 5 different platforms that push text messages out to our patients, not connected, and that's not a good situation. So the idea here is let's unify this into a single view of the patient. And the advantage is not just the individual patient, but that family, that household, so that when a call does come in, I not only see Molly popping up on the screen, but I have a perspective of her spouse, kids, if that's the case, and can actually accomplish multiple conversations, multiple scheduling. Molly, let's take care of you. And it looks like one of your kids is overdue for their annual exam or a student physical. Would you like to schedule that one now too? And so the efficiencies that come with that and revenue, and of course, Molly's going to be appreciative of that too. Another key aspect, it's only a minor note in here, but a preference center, a multi-channel preference center. Really important that you take a serious look at that. We've experienced those in many other industries, not in healthcare. So think about this. How do I want to manage my email, text, phone, whatever? And as nice as it would be to say, just pick one for everything, that's not the way any of us work. I'd probably like my bills to come by email. I want my appointment reminders to come by text, and so on. So give me that flexibility to do that. Epic has a mini version of that. Good start, great start, but doesn't go far enough. And so we're looking to expand that out and connect the two and really give our patient the ability to control that. Now, that said, then we've got to invite them to actually give us their preferences. Then we have to honor those. So massive project, but you need to do it because we're used to operating that way with other businesses. On the next one, I'll just briefly touch on the call center aspects of this too. As Jamie is referencing, as much as we think about digital, there's still huge call volumes. And a lot of people just simply prefer, you know what, I'd rather get you on the phone because there's a lot of back and forth. I'll look at my schedule. You tell me what we can do. Okay, this doctor is not available then, but I want it this week within this geography. And can you get me into one of his or her partners? Great. Okay, so oftentimes easier to manage on the phone. So we're looking to consolidate a huge amount of that too. And importantly, a single screen. So if I'm a call rep, I don't have 8 different platforms and Epic and everything else to look at. It's all coming together right here in front of my face. And if I can do that and let that platform connect to everything else, simplifies my job as a call rep. I can do a better job providing a better experience for my patient and augment some of that, whether it's AI or bots or various knowledge documentation centers, so that we all have exposure, so that if I do call back, whoever I talk to in whatever location, they can pick up kind of where that conversation left off, and I don't have to start all over again, which will drive me crazy as a patient. And as you can imagine, there's triaging and scheduling and referrals and classes and events, and the list goes on. But a lot of pressure on our call center staff, and they do an amazing job. With the next slide, just want to sort of wrap up some of this here on these perspectives and this is not intended to be the final answer to everything. This is not the end of the experience. All we're really doing here is scratching the surface just a little bit. But if everything is connected magically, if we are able to understand the timing and Molly's preferences of how she would like to be communicated, we can start to change the nature of this conversation in a very, very different way. So that, hey, Molly, I'll send you an email. It's time for your annual mammogram. Would you like to schedule that online, or tap here to click and talk to a rep right now? Let's do that when it's convenient for you, hopefully not us, even though, well, that means we have to be there. Thank you for getting that. There's a confirmation text because that's the way you would like it. Thank you for scheduling that. That arrives within minutes after you've completed that. So you can rest assured everything you wanted was captured as you want it done. And if we do this right, tap and it will be added to your iPhone or Google phone or whatever you have, or it's Outlook, and let's get that put into your calendar so you don't forget. In case you do, we'll send you a reminder. You've decided you want that by text. And let's not just send a reminder. Let's give you directions, a link to Google Maps, whatever makes sense. Conceivably, is transportation an issue for you? Would we like to include a link for Uber or whatever might help get you there? So the challenge here is, can we think broadly and differently to help you out and ensure, from our perspective, you actually show up and get there on time? We'd appreciate that. Our providers would appreciate that. The revenue side would appreciate that. But certainly this is for the patient and their convenience. In the end, what often is the case is, especially for younger folks, healthy, well, different perspectives on, do I need an annual exam or not? I'm not going to show up, or I don't need that for years. I'm not sick. How do we stay engaged with you on a somewhat regular basis so that there is an actual relationship, but it's on your terms, not ours? We're not going to try to force you in if you feel it's not appropriate. But whether it's, as Jamie mentioned, we've got meditation and all kinds of other options in our app, but are there things that we can help you along your wellness journey, trying to lose a few pounds, whatever that might be, but let's stay connected and see how we can help you out. So again, think of this differently. There's many different platforms, it's different software, but how would your patient, and don't guess, ask, surveys are one way, but gain as much feedback as you can and build that experience around them. Test it, figure it out, get reaction, make it iterative, because it's never going to be just a single, oh, I've got the answer, I personally figured it out, and let's do this. One other twist to all of this is, in spite of all the background and information you will probably do to build this right, is measure it. And so much of this is very measurable. And to be honest, that's how you're going to know if you got it right. We talk about conversion all the time and from a digital standpoint, but that whole process from inviting you to schedule an appointment, did you do it? Did you show up? Do we have follow-up, your use of the app, et cetera? We know the data, and we know, to be honest, if it's working or not. We constantly test subject lines, for example, and can get increased improvement in connection and reading of that information. But we would never know if we didn't test it. So I just encourage you to test and evaluate and realize you're never done, but it's worth the effort. With that, I will turn it back to Jamie for a wrap-up.
As we've stated, I think this is a journey. It's built on insights and data, not only from the consumer, but from the business. Our vision, we've shared with you several different pieces of the puzzle today, from our website to LiveWell. We're an Epic shop, so that's the core, and then CRM and call center. Our vision is that in the very, very near future, the next 12 to 18 months, all of these tools converge around our CRM system, because that is what it is, customer relationship management. That's where that consumer data lives. It will feed LiveWell, it will feed our websites, it will feed our call centers, so that we truly deliver this 360-degree view of the consumer. So the journey for us has been looking at pieces of the puzzle and building those. And where we are now is better connecting those dots into a singular platform that will be the engine that drives that seamless end-to-end consumer experience. So it's not just about the tools, it is about how you connect the tools. Our goal is to make it easy to find what you're looking for, connect with us as an organization, for us to anticipate your needs and provide you better care than you can get anywhere else, and help you live the life that you want to live. And we do that through targeted communications and making sure that the consumer is at the center of everything that we do. So long journey. I know there's questions that we'll answer here as we go, and we're going to leave some time for that. But it's how you piece those things together with the consumer at the center that really bring the consumer experience to life, not only in the tools, but in partnership with operations, in partnership with the business, because all these tools really are designed to augment that clinical experience that you have that great care that you get at the front line of our organization and that relationship that you have with those who provide care. So Gary, I'll hand it off to you, the last one here before we go to questions.
Yeah, thank you both. That was an amazing story, and it continues to evolve day by day. We're all these calls together, and so I know that from a first-person perspective. So let's just take a quick snapshot before we move into Q&A. If there's two words that keep folks like Jamie and Murray and subsequently their leadership, including CIOs, up at night, especially in a just highly now disruptive, post-pandemic, what else can you throw into it, kind of matrix of things that are now seemingly getting in the way of provider growth. Two words that are now rising above the rest are standardize and consolidate, particularly around technology. And you've heard Murray and Jamie both allude to this. You could see it across the presentation. And if you look very carefully in terms of at least at the bare minimum, our partnership, CRM, engage across the top line here, CRM Engagement Center and Content Management Content Center are now as part of the core structure of the Advocate Aurora universe that are slowly but somewhat eloquently being tied and tethered together. With that, they are also provisioning data and analytics and most progressively, a highly set of advanced APIs which are going to universally provide synchronous and asynchronous data to start matriculating and passing back and forth through these solutions in near real time and or real time over time. This is the journey, to really summarize it, that most, I don't care if you're small, mid-sized, regional, multi-regional, national, everybody should be slowly getting on this journey of getting away from point solutions that are ultimately non-integrated, coming from countless different vendors and partners across North America and the world, and beginning to find ways to scale, cut costs, and grow at the same time. That requires an effort of standardization and consolidation of what we would ultimately define as universally best-of-breed technologies and tools, all of which both Jamie and Murray have alluded to. So that's where this framework really begins to come into play, and ultimately allowing these tools to carry the brunt of all of your successes going forward. So with that, we will wrap, and we will open it up to Q&A, and we'll hand it back to Becker.
Wonderful. Well, Gary, Murray, and Jamie, thank you so much for such an insightful presentation. Like Gary said, we can now start the Q&A session. If you have any questions that you would like to ask our panelists, please submit them in the Q&A box you see on your screen, and we'll try to get through as many questions as we have time for. Looks like a lot of great questions have already started rolling in. The first is, what does your digital org structure look like, and what is the relationship with your operational leaders?
I'm happy to answer that. The digital team kind of has two components: the consumer experience team, which is our strategy and experience design group, and then our core digital team. We happen to have our own technology team. We operate independently of HIT, so we're fortunate there. That's kind of an agency model that we use there to service our marketing and consumer experience work. From an operational alignment, all of our key initiatives from a consumer-first standpoint, LiveWell, virtual health, enhanced scheduling, and this larger project, which we walked through today, I co-chair with someone in operations or in the medical group. So these are joint ventures, if you will, across the organization, so that we are locking in that strategic alignment with other parts of the organization. We're having those executive buy-in. That all ladders up to a consumer-first executive committee, which has several of our senior leaders from across the organization that represent critical components. So they're governed that way. They are co-chaired to ensure alignment. And then we have a core team that drives a lot of the work, but also borrows from IT and other parts of the organization based on the project.
Perfect. Thanks for outlining sort of what that structure looks like. I think that's helpful for our audience to hear. We have another audience member who's asking, how do you evaluate success downstream for the patients that you serve? Are you able to see what connection points resonated with consumers?
We're at an early phase of that, so I can't give the complete answer, but at least in concept, if you look at communications, and I'll just give you a very simple example that we have actually used working with our Pop Health team. We did look at some outreach around mammogram, go back to that example, and we did have a control group. So these were women who were, I believe, 2 years overdue, and sent an email message, and we got, I believe it was a 36% completion looking at the next 3 months. 36% of these women, after being 2 years late, completed a mammogram. We thought, my God, that's incredible. Well, then we looked at the control group, and 30% in the control group did. So reality is 6% lift. We were able to help that by 6%. That's still great. But being able to measure what you're doing, and we had tested some messages and a variety of things to ensure we were hopefully getting the emails read and then getting people to act. But there's ways to do that. And essentially, if with digital code, whether it's search on the front end or pushing an email off of your CRM platform to your patients, you know, especially with an email or text example, you know who you're reaching. You know exactly who you're reaching and communicating to. Then, after the fact, you can look at the visits that were completed and the revenue attached to those. So it's not that hard to try different things, monitor that group, see if they came in, and if you're able to use a control group, you'll know the improvement that you got by doing that. And switch it around. You might lead first with an email, follow up with a phone call. Again, you can measure those things. None of this is, I'll say, slam dunk easy. But if you don't do it, you are just guessing all the time and you don't know what works.
One other last point there is we, at the individual contact points, we're measuring ease of use. So we are doing follow-up and real-time, quick, on a scale of 1 to 5, was this easy to use? So we're not only looking at the downstream, we're measuring the touch points from an ease of use perspective.
Got it. Thanks for adding that. Mm-hmm.
I was just going to give one other quick example. A lot of folks use health risk assessments or other similar devices to at least engage with people. We have a pretty good handle on, did we encourage you to do that? Did you start it? Did you complete it? And then did that translate into some sort of a visit after the fact? And it's not too hard to measure that whole flow and know what's the percentage of conversion, the taking action at each of those steps, and then determining, oh, this is our weak point. Let's work on that one weak point of conversion, and hopefully we can let the rest take care of itself.
Perfect. Well, we have another audience question here, sort of about that value analysis process. This person is asking, should we do a formal value stream analysis of these processes to look at current and future state?
Yeah, this is a tough one. This was back to the journey. Our analysis on the CRM and call center project, we've been working on it for a long time, but it really heated up over the last 9 to 12 months, and really understanding, mapping the different touch points, mapping the different systems, understanding from a value perspective where we're generating value and what those downstream implications were. It's very difficult and tricky, and frankly, we had a pretty good idea of that after the work that we had done once this project was approved. But post-approval, when we really rolled up our sleeves and had permission to go deeper and farther, Murray alluded to this, we uncovered more than we thought existed after the first round of analysis. So it's important to do, and you have to do it at a kind of a high level to scope the opportunity for your business. But I will warn you, once you roll up your sleeves and get into it, you're going to find things that you didn't know were there as you really get into the work.
And I'll give you 2 quick examples. So to do a value stream on everything, on every journey, every opportunity will kill you. It's just, it will prevent you from progressing. And I'll just offer 2 easy examples. If all you do is and everybody is aware of this, the call center example that we used. If all we do is get a little bit of efficiency out of that, it can pay for probably the entire project, whether that's recouping some of the abandoned calls or simply reducing call time by 25%. Think of the impact that you can quantify. Or everybody has an issue with cancellations and no-shows. There's another one. Whatever your numbers are, what if you could improve that by 5 percentage points, or 5% or 10%, just a small dent in your cancellation and no-shows? Chances are pretty good you could pay for all of this work. So I'm not suggesting that that's all that matters, but don't get bogged down in everything, because it will be, you'll never get started.
Great, thank you for those insights, Marie and Jamie. The next question is, which of your platforms do you see to be the core for your call center?
We have settled on, I'll say, a combination of two, being Healthgrade's Engagement Center and tied with Salesforce licensing and the rest of the modules that go with it. So that's the foundation that we're looking to work through.
Perfect. The next question we have from an audience member says, did you involve your IT ops team as you were working on this project? And at what stage did you get them involved? And sort of what was your role with that?
Great question. They've been involved along the way. So there was a core group that was put together to do the initial analysis. So kind of a small team that did include a couple of our IT leaders, really understanding largest implications to them around the integration with Epic, how it interfaces with our call centers as they support our IBRs and other groups. So they've been with us on the journey, and now our CIO sits on our Consumer First Executive Committee that is chaired by our Chief Marketing Officer. And we have technology teams embedded in this project moving forward. So there's a steering committee that governs this project that has several IT leaders that represent different parts of the business that we're touching. So involved all the way through, smaller group in the beginning, much larger group now as we're rolling up our sleeves and touching the different systems. So I think it's a critical point. You need to have the kind of the major players in the room. I do recommend keeping that group small initially to formulate the opportunity. Like Murray said, pick a few of those big wins that can transform, use that as the foundation, and then build the right operating structure with IT, ops, business, finance, all in the room with you.
And just to state the obvious, if you don't have a good relationship with IT, it's time to start. Yes. We are blessed. Sincerely, this is not just an offhand comment. We are very lucky to have an outstanding relationship with IT, with so many people, help, cooperation, intelligent folks, and could not function without them.
Wonderful. Thank you both for weighing in there. Another question is, how did you map all of your touch points?
It's a work in progress. I think, as we build these different tools and we build these different areas, we're moving heavily to personas and journey-based experiences as how we map those things, understanding how consumers interact with us as an organization. But we're also looking outside of healthcare to pull in a few of those best-in-class examples. We started with a reference to travel. The airline industry, heavily regulated, has been on a digital transformation journey much longer. Same thing for finance. So we're looking at outside the organization and kind of borrowing from them around what those touch points look like. And then as we launch projects, we're documenting, tracking, but really looking more from a journey standpoint in how we build that more aggressively moving forward.
Perfect. Thank you again for those insights. We have another audience member who's asking, how have you been able to measure the ROI for your digital investments? Some are easier than others, but for example, investments to leverage a web portal may not be directly related to a dollar value.
That's a good question. I'll kick this off, and Murray will probably provide better insights for you. We look at things like web traffic and then to conversion, whether that's an appointment scheduled, an appointment request, calendar events. Specifically to the appointment scheduled, we have a ballpark proxy number for what a primary care visit is, what an urgent care visit is. That revenue is attributed at the clinical end point, but we are marking it as an impact that we're making. Not that we get to calculate that revenue as a true ROI, but we are influencing that as we look at it. And then as Murray mentioned, some of the other downstream work where we can fully connect those dots, again, we're reinforcing they started that journey in a digital channel and completed that journey. So I don't know, Murray, any other thoughts?
Just that there's a range of precision, and so be careful to not get hung up too far on this. On the one hand, it is very precise using some of the examples I gave you where you're pushing an email or text message, you know who the target is, you know what they did. It's very, very clear cut in the kind of results and the revenue that you get from that. So you can do the ROI calculation and be very precise about it. You've got the other end where it's search and other things coming in. I don't know yet who you are, or there's multiple channels of communication going on and people get into the attribution thing, trying to figure out the one perfect channel to attribute this to. That gets very difficult. So we do capture everything that Jamie was referring to. Some are, you know what, we're going to be conservative and we will only capture 10% of the value that's going on from this particular activity. But then there's others, we know exactly what we did, and we are very willing to capture 100% of the value of that activity. And there's a huge amount of gray area in between. So don't get too hung up on everything has to be perfect. But again, and I've touched base with our finance folks and other analysts to make sure that the data we're using is the same data they're using. So it's not marketing math, it's the real deal.
Wonderful. Well, thank you both for weighing in on that question. We have another one here from an audience member who's asking, where does this consumer journey factor in Advocate Aurora Health's revenue cycle and payment for services?
Yeah, those folks are in the room with us. So when we look at what those journeys look like, we look at those different touch points. We understand that the ability to capture revenue, the ability to drive referrals, the ability to drive other pieces is a critical piece of the puzzle. And frankly, our ability to take friction out of that process for the consumers is part of our commitment to the revenue side of the organization. If we can make it easier to close and schedule that next appointment for the follow-up visit, if we can make it easier to close and drive that referral to the specialist, that's part of what we're looking at here is how do we take friction out of the system, use the data that we have of the consumer on the right touch point to help close that gap. That also services at the front line. Ultimately, how do we provide tools at that end to make sure that that happens? And then frankly, we're looking at the billing experience. How do we make it easier? How do we make the bill easier to understand? That was frankly one of the first things we tackled in our consumer experience journey was the billing side in making that bill easier to understand, navigate, and then promote access to getting it paid, to financial services and other aspects. So both in enabling the financial experience and making it easier so that we can capture revenue, and then two, how do we generate revenue by making it easier and more seamless for the consumer to take that next best action.
Wonderful. Well, that is all the time that we have left for today. I want to thank Jamie, Murray, and Gary for such an excellent presentation. And thank you to HealthGrades for sponsoring today's webinar. I hope everyone enjoys the rest of their day, and we look forward to having you join us for future webinars.
Thank you.
Thank you.